Hello and welcome back to our channel. Today we are talking about a spine condition that sounds complicated but is more common than you think: cervical kyphosis. To help us understand this better, we are joined by Dr. Deepak Agarwal, professor in neurosurgery at AIIMS Delhi. Sir, let's start with the basics. What exactly is cervical kyphosis in simple words?
Cervical kyphosis is abnormal curvature of the cervical spine, and cervical spine is that part of the spine which resides in your neck. So it is the spine in the back of your neck. And when it is bent abnormally, it is known as cervical kyphosis. Normally what happens is that the spine is bent inwards in the normal patients or normal human beings. When this curvature becomes outwards, we call it technically as kyphosis.
Okay, and what causes this kind of curvature? Is it something we are born with?
Not usually. Yes, in some cases it can be congenital and that we are born with this kind of abnormal curvature, but usually it is secondary to other pathologies, and trauma being one of them. So any injury or trauma can lead to abnormal curvature. Besides this, we can have other pathologies like infection and degenerative spine, which happens because of wrong posture. So if you are always on your laptop or your mobile, over time degeneration will happen faster in those people and lead to loss of curvature. Besides this, there are rare causes such as tumors or previous spine surgery.
Okay, sir. Sir, is it painful? And how does someone know if they have it? Are there any symptoms?
Yes, that's a good question. It can be painful or it could be painless. Initially, obviously, it starts with just stiffness of the neck and a painless change in the curvature. However, with time, you may have pain along with numbness, paresthesias, which are tingling sensation in both your arms or in the neck, along with painful restriction of neck movements. After some time, obviously, the curvature becomes obvious and you start to, other people may notice that you have a abnormal curvature of the neck, and in extreme cases you might have chin on chest. So your chin actually comes down to the chest part. This is the extreme end of the cervical kyphosis.
So is cervical kyphosis dangerous if ignored?
Absolutely. If cervical kyphosis is developing, it's best to have treatment done as early as possible, because as the kyphosis progresses, there is compression of the nerves as well as the spinal cord, and when that happens, there could be weakness and numbness of both the lower limbs as well as the upper limb, leading to loss of movement, which can be very dangerous, and as you all understand, it can be very debilitating also.
So how do you confirm if someone has cervical kyphosis? Like, how is it diagnosed?
Yes, first we do a full physical examination as well as take a detailed history, followed by a neurological examination. Then we can order various radiological tests like X-rays, CTs, MRIs of the spine, specifically of the cervical spine, to see what is the extent of the kyphosis, what is the underlying cause, and to finalize further management.
Can it be treated without surgery, sir?
If it is, I would say, very early when we pick it up, yes, it can be treated without surgery, but that is in a small subset of cases. Posture correction is very important, and obviously we can use some bracing in the initial phases. If that doesn't work, then we obviously advise surgery in the majority of the cases where it is majorly symptomatic.
So what does the surgery involve? Is it risky or is it safe?
See, surgery is, there is always a small risk, and depending on the kyphosis, the risk increases. But in a good center like AIIMS, the risk is obviously balanced with the expertise of the surgeons. And the surgery entails, decompression of the spine, realignment, fixation using rods and screws, and finally, post surgery rehabilitation to ensure that the posture remains correct, and the patient does the physiotherapy so that instead of stabilizing, it further improves with time.
Okay. And how long does the recovery take, sir?
That's a good question. See, surgery itself takes few hours to a day, and the patient's hospital stay will be there for a few days to a maximum of a week if there are no complications. But the major part is the time after the surgery and discharge from the hospital, and that takes few weeks to months when the patient has to learn to live with the disability and to do certain lifestyle changes so that the surgery, whatever we have done, it helps him rather than making him worse.
Sir, can cervical kyphosis be prevented? What would you advise our viewers?
Absolutely. In cases where the cause is degenerative, and which is the majority of the cases, cervical kyphosis can definitely be prevented. And the most important thing is to have proper posture. So if you sit properly while you're working on your laptop, computer, tablets, have an ergonomic chair, make sure you exercise regularly, and do some neck exercises as a daily habit. Definitely, these things can go a long way in preventing degeneration of the spine.
Thank you so much, sir, for breaking it down so simply.
My pleasure.
So guys, if you found this video helpful, don't forget to like, share and subscribe for more health insights from Dr. Deepak Agarwal. Got questions? Drop them in the comments and we'll bring them up in the next video. Thanks for watching.